is really challenging those. So one of the ways we can do that is we walk through this automatic thought chart. So for me, a colleague walks past me at work and she seems to ignore me. And I'm like, what the heck? Like, she ignored me, she must be mad about something. What could she possibly be mad about? I don't know. And then you all know the feeling, right? Like, I start to sweat a little bit, my face is getting a little red, I'm a little panicked, and I suddenly feel like sad, anxious, and rejected. Like, oh, I really like her, like, why is she mad at me? And then it's like, okay, so I just manifested that whole thing, right? Just because this person didn't look up. It's kind of fun because this was pre-COVID, and then like during COVID, it's like they probably didn't even recognize me because I had a mask on, right? No one knows what anyone looks like anymore. And then I started to think like, but also like I was late on that project, and I was also late to work one day this week, like, oh, this stinks. But then when I challenge it, it's like, well, I wasn't really that late, it's not that big of a deal. She's typically pays attention, she typically says hi, maybe she's busy, and we just had coffee together last week. So I have some evidence to show like, maybe she's not mad. But then how should I change that thought? Can I physically change that thought to say like, she's in a rush. Everyone's looking down at their phones. Like, it's lucky I don't fall on my face like 10 times a day, right? Maybe we had masks on and they didn't even recognize me. Or maybe you're just in your own world, right? Like, we all do that all the time. Like, you only see what's in front of you. So can we really challenge that thought? And the same thing for our kids, whether it comes to sitting down at homework and being like, I can't do it. Okay, tell me why you think you can't do it. What are some evidence to suggest that you can do it? And so can we change that thought away from, I can't do it, to, I can do it if I X, Y, and Z. So really those cognitions and automatic thoughts are the core piece of cognitive behavioral therapy that I want anyone who has anxiety or depression working on. I want to make sure to mention ADHD, partially because, again, like I said, our diagnostic manual publisher changes everything every handful of years. And what we used to call ADD is now ADHD, predominantly inattentive presentation. So if you hear that as a parent, I have parents say to me all the time, but they don't have the H. And I'm like, I totally agree. They don't have the H. They don't have the hyperactivity. They don't have the impulsivity, but they have the inattention, and that's just how they named it. And so that's the label you're going to see. You can use ADD if you want. It doesn't really bother me at all. As long as you know when you see it in your insurance, when you see it in documentation, the H is there, but it doesn't necessarily apply if you have that predominantly inattentive presentation that's just the inattention piece. I see it very rarely, but sometimes kids have outstanding attention, but they're super hyperactive and impulsive. And so when that comes up, that's the predominantly hyperactive and impulsive type. I don't see that as much because typically it's really hard to be super hyperactive and impulsive and still maintaining your attention to everything that's going on around you. Combined presentation is both. So inattention with the hyperactivity and impulsivity, or like I said, you could have other specified or unspecified. I use other specified a lot for my patients who have had chemotherapy and the chemo has impacted their attention span or processing speed, have had strokes or epilepsy or some type of brain surgery that impacted that cortical striatal pathway. And then onset has to be prior to age 12. So if it's not seeing signs and symptoms prior to age 12, ADHD is really a developmental disorder, so we expect to see it initiated in childhood. Super important to keep in mind, again, I'm a PhD, not an MD, so I'm not going to prescribe you ADHD medication, but a combination of school-based accommodations, ADHD medications, and home-based interventions are the most effective. So thousands and thousands of papers on this. You have to really have all three in combination. Medication can help, and that's fantastic. I've seen huge improvements on medications, but it also helps to have all those home interventions in place and academic supports. It was a lot of information, and that's literally like this much of a huge diagnostic manual. But those are the most common things that I would expect us to see in our school-aged kids. Now, when we think about being parents, all we do is judge and criticize ourselves and think that we could do it better and try to find out more information, and then judge or criticize ourselves more when we don't put that new information into place, right? So things I want you to just think about doing, and remember, and for those of you who know me, you know this is all aspirational, and I'm not doing this every single day. Like, I'm lucky I got dressed this morning, and there's like clean clothes at home. So keep in mind, I do my best to do this, but there are absolutely times where I'm like, yeah, that was not a great day. And we're gonna try again tomorrow, and we'll talk about that. So if you can find time every day to have just 10 minutes with your kids, put every device away. If they're little, play together, sit down with them. If it's older, just hanging out near them and asking a few questions. How was your day? What's going on? Not question, 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 question. Sit there in that awkward silence, even if they don't respond. Like, again, if you know Teddy, he looks at me sometimes like, ugh, this one again. Like, just sit next to him for 10, 15 minutes, and then when he has something to share, he's gonna share it with me. But I don't have to push and push and push to get that information out of them. And same thing for our older kids too. Just being there, knowing that they have a time each day to check in, and then you start to learn, who are they hanging out with? What are they doing? And so when you see changes in those behaviors, you already kind of have established that baseline over time. And again, if you haven't been doing that, it's totally fine too. It's never too late to start. So just finding that time where we're just present and physically with our kids. Something really important that I want to mention here too is, especially, and I think I have it in here, when they bring something really big, like so-and-so did this, either drugs, alcohol, vaping, something happened on social media, someone, there's been a lot of sexual activity lately, like not freaking out. Like inside you're gonna be like, what is happening? But like calm and cool, calm and cool, calm and cool. And you can go in your room later and scream and freak out, especially with suicidality. So staying calm, staying cool, taking a deep breath and being like, okay, tell me a little bit more. If our kids come to us and say, I want to die, I've been thinking about hurting myself, it'd be better if I wasn't here anymore. Rather than the first parental response is usually, why would you ever think that? We have such a beautiful life. We do this, you have two parents who love you so much, you go to this amazing school, you have all these things, and so we start justifying why they shouldn't be feeling that way, when that's only going to prevent them from thinking like, oh, like she's just going to try to problem solve this, rather than saying, let's stop, let's calmly just tell me what's going on, like tell me what's happening, you know, help me understand why you feel that way. I think some of you know this, my favorite response is like, help me understand X, right? You hear me say that all the time. Rather than me being like, what are you talking about? Like, help me understand. So staying calm, staying cool, I cannot stress that enough. And then providing some good self-talk. But then, I follow some great people on Instagram, and this Big Life Journal posted this the other day, and I was like, this is amazing for every parent to know. So we're gonna talk about 4 different ways to kind of change your communication. The first one is comparing your family with other families. So why can't we just have a calm dinner like other families? Like, look around this restaurant. Why are you under the table? This is actually real life, right? That happens all the time. Like, if you know Eric, he's like, get up off the floor. Look around. No one else is doing this. And it's like, okay, but now we're suddenly doing all social comparison, right? And we're teaching our kids that we are looking to other people for what our behavior should be like, rather than centering back to our own values. And he gets so annoyed with me when I do this. Yeah, probably living with me is not easy. And so I was like, this week, this day, this hour has been super tough for everybody, right? So like maybe tomorrow we're gonna reset and try a different day. If he's like, who cares? And half the time I'm like, I don't care, then we're fine, then we can have a dinner, we can pretend he's not here. It's fine. Like, you know, so we center, not socially comparing. So if you, why can't we do this like so-and-so? Back up. How can we back that up so we're not engaging in that social comparison? Leading by fear. Super interesting during the pandemic, right? Like, if you don't wear a mask, if you don't do this, if you don't do that, you're gonna die, you're gonna kill someone, right? Like, how many kids have come in and been like, well, what if I kill someone who kills someone who kills someone, right? Like this whole leading by fear. Rather than saying, I know you wanna do this, right? I just wanna make sure that you're safe and that other people around you are safe, so let's find a different way to do this. Climbing a tree, going to the playground. Like, this kid will climb all the way up to the top of anything he can find, right? So like, get down from there, you're gonna get hurt, you're gonna break a bone. I end up saying like, we're gonna go to the emergency room and I'm gonna have to figure out who's there, and then we're gonna have to like, make sure that I like them, right? But I know you wanna climb that. That looks amazing. Can we find something that's just a little bit safer, right? And for me and my own anxiety, saying, that's causing me anxiety. My anxiety feels like I worry about you, my stomach starts to get upset. I need to calm myself down, but also I need to make sure you're safe. Because whenever we can model that for our kids, the better. This next one is distraction. This is literally me. Hold on, I just need to reply to one more email. I just need to do this. I just need to finish dinner. I just need a second, right? One day we were sitting down and Teddy had like a little, like a leapfrog out. And I was like, okay, we gotta go take it back. And he goes, Mommy, just one more email. And I was like, oh, parenting fail. So I think that the transition here is really good for everyone. So this seems really important to you. Instead, I was about to finish up this one more email. So let's meet in the playroom. Let's meet in the kitchen in 5 minutes and we can talk through it together. So the super big key here, especially for our littles and our school-age kids, is when can you come back around? So where should we meet and in what amount of time? So even if you need to set a timer, I'm gonna set a timer and in 5 minutes we're gonna reconvene. Rather than and we all do it, right? 2 seconds, 2 seconds, change it. How much time is it really gonna be? It's not gonna be 2 seconds. And where can you meet them? And then if there's anything I can send you all home with, it's to not ignore your own needs. Because healthy family starts with healthy parents. And our kids are only as healthy as our parents are. So we all say this, right? I just don't have time to take a break. I'm too busy. There's too much going on. I'm never gonna get it all done. We have to model for our kids that we cannot be running and going forever all the time. So I need a 15-minute break in the bedroom. Maybe not with a glass of wine. I'll leave that up to you. Then we can figure out dinner and we'll figure out the rest of the night. But taking that time for yourself, removing yourself from the situation before our big emotions take a hold of ourselves when we're already feeling stressed and anxious and prevent us from really responding in the way that we want to. Now, if you respond in a way that's overwhelmed, that's heightened, a really good opportunity to say, I was super stressed, I felt overwhelmed, and I let those emotions bubble up. I'm gonna do better next time. And really saying that to our kids and modeling how you fix it when something like that has happened, right? These are the skills that build resiliency. These are the skills that get us through when times are tough. And it really has to start with all of us as a community to do that. So I would love to see you even just take one of those away. And again, we talked about this, but I just want to make sure it was here, especially because suicide is one of those things that people get not only really upset talking about, but often are scared to talk about. And it's something, again, I want everyone to know you can always come and talk to me about this. Staying calm, listening, assessing thoughts and plans, and taking it seriously. If there's one thing I want everyone to do now or soon, is all the medications in your house should be behind a locked door. End of story. So, and if it's in the bathroom, in the linen closet, grab one of those little keypad locks from Lowe's or Home Depot. Doesn't have to be a key that I'm inevitably gonna lose. Just put a keypad on it. Tylenol is actually the #1 most dangerous drug you can have in your house. It's something that people don't know. So overdoses on Tylenol are incredibly common. Tylenol is incredibly dangerous at high doses. But it's something that our pediatrician tells us to give our kids, right? So all those medications, whenever possible, locked up, and just started out that way, right? We don't know who's coming into our house. It could be a contractor there's plenty of stories of contractors stealing Oxy and people coming in who do stuff in your home. So lock up those medications. Things you also don't think about if you do have concerns for self-harm in your kids: knives, scissors, charging cords. We've seen a lot more strangulation with iPhone cords, TV cords, things like that lately too. So shorter the better whenever you can. And then non-suicidal self-harm. So 1 in 4 female adolescents will engage in some type of non-suicidal self-harm. So that's skin scratching, picking, cutting, things like that. Not always suicidal in nature, oftentimes related to either a release or a trauma. So things to watch, but recognize that's not always related to suicide. Sometimes it's a coping strategy. National Suicide Prevention Lifeline, of course, we hear a ton about. 988 is going live in Florida. I'm actually a little concerned about how that's going to roll out, just given our lack of a workforce to be able to best support it, but it sounds like 988 is going to go straight to the Suicide Prevention Lifeline. We do have a couple mobile crisis situations in our county and surrounding counties. if things ever got to that degree, calling mobile crisis is preferred to generally calling law enforcement. Law enforcement's going to do a Baker Act. And then I didn't know if you guys wanted to talk about the Baker Act. Super interesting in Florida, 72-hour involuntary hold for kids who are experiencing suicidality. Right now at the hospital, we actually don't have inpatient psychiatric beds, and so if you come to the hospital with concerns for suicide, my team is going to help place you somewhere in the state. And because we actually only have 29 psychiatric inpatient beds for pediatrics in the county, oftentimes that is outside of the county. It is one of our goals. We have a strategic plan right now to hopefully have 60 to 80 beds, so we would quadruple that number. Our consultants tell us we're 294 beds short for the hospital's 17-county radius for inpatient psych for kids. That's just kids. So it's a system that needs a lot, but doesn't get a lot of reimbursement. So I'm happy to answer any questions at all. That was quick and a lot of information, but if there's anything you can take away, it's just please be kind to yourselves and be kind to others, and understand that like everyone has been through so much. I've never seen as much stress and anxiety and just heightened mental health across families. 160,000 kids in the United States lost their primary or secondary caregiver to COVID. And so it's just been a huge transition for everyone. So thanks for having me. See everyone, yeah. Great.
So first I want to like lock you in my house and for 3 days and just have all of these discussions because the amount of information that you have, I feel like is so
very
valuable.
kind. We both know that would never happen. We just talk about it.
I wouldn't actually have to lock you.
I would just hang out.
So my question, well, I feel like I have 1,000 questions, but I'm trying to boil it down to one or two. My question is two different ones actually. So I have, my oldest is only 7, but he's traditionally, you know, he'll talk about Legos all day long or this or that, but when he gets in the car, he's not a big like, open up and this is what happened today. He's not a chatterbox. I mean, I'll find out like, hey, somebody like did a cartwheel off their desk from another parent. And I'm like, what happened today? He's like, oh, nothing. Like, are they?
Oh no, I just asked him. Like, what did Ellie say?
Yeah, no, exactly.
Yeah.
But are there better questions that we could be asking when we're having those 5 or 10 minutes? Or is it really just about the kid?
It's about the kid. Like, how's your day? Yeah. The biggest, most important thing is to not keep, well, you did something today. I know you did something today. I'm paying all this money for your school. You better have done something today. Right? Sitting in the silence, because eventually it's going to come out if something happens. So the more you kind of question, be present.
And then I guess the question that sort of goes along with that, as the puberty age happens and there's so many more emotions and so many more challenges that go along with that, are there ways to handle that better, or just do we try to let the kid lead?
Let the kid lead and be along with it.
Okay.
Yeah, and giving that space and time, right? Okay. Especially like, I think the hardest things to hear are your hormones are growing crazy and that's why you're acting that way. Because then we've already told them it's something wrong with you, right? Like, I understand this was a challenge. That was really hard. I'm gonna go take a minute, you can go take a minute, and then we can come back together and talk about it, right? So like thinking about that language too, because that's what we just come to, right? Like, puberty and these hormones, like you're automatically.
And the concept of withdrawing, like they tend to withdraw a little bit more during that time and not freaking out. Not freaking out.
It's interesting. I had a woman ask me this weekend. She has kids, and one of them has to listen to music when he's studying. And I said to her, like, is he doing okay at school? And because I personally have to have music or like the TV on in the background. And that's, if you hear me talk about social media, that's terrible. But I have to have something. And she was like, yeah, he's in college, like he's going to medical school. I'm like, then why do you care? You know, like honestly, like clearly he's been successful, you know, so what's the big deal? So I think that like saying like, am I willing to really go to battle over this?
Yeah.
You know, if they're doing great at school, it's different. Are you on Snapchat the whole time you're doing homework and you're not getting your homework done because you're Snapchatting everyone and their brother? Yeah.
Thank you. 2 questions that I think are kind of connected. The first is, versus 10. At what age do kids start to connect with what they're feeling to put into words? You know what I mean? Like Grayson, I have the exact opposite. Grayson gets in my car and I know everything.
Yeah.
Which is great, and to the point that when he gets in my car, he doesn't talk. I have to think, there's been a handful of times that he'll see me pulled over, and I'm like, all right,
Yep, exactly.
stay here.
And that's just, I wanted to highlight that, Michelle, because you can't pay attention to driving and listen at the same time.
Right.
So you pulled over to be present and give your full attention. I love that.
So, you know, he's pretty articulate, things like that, but I don't always know that he even knows the right, because sometimes he'll use a word, I'm like, that doesn't know what that word means. Now, at the same time, you know, when I was looking at that amazing list of irritability and things like that, I know I'm not the only one probably in this room where when you're feeling something, then the person you use Google, right? And you're going to say, oh, I've got this, and this. So we're at the age where I guess the Grayson-year-old is he already recognizing it, or would he need someone that can help him figure out the right words and
So a couple different pieces. The bad news and maybe the good news is that the frontal lobe, so the front part of our brain, actually develops until age 25. So that's in charge of like emotional regulation, cause and effect, logic, reasoning. So 25, like for, yeah. Needless to say, girls tend to be ahead, sorry. Girls tend to be a little bit more advanced in that, right? But, you know, I really expect all of that. What's going to come online from a neuroanatomical perspective is going to come online by age 25. There was something else I wanted to say. Tell me again.
Oh, just the part where you can sit there and go down a rabbit hole.
Oh, going down a rabbit hole and looking through things. Yeah, because you're going to end up with like a crazy thing, right? So, you know, Googling some things, but once you start to like really feel that anxiety raise and get heightened, you got to stop yourself. And a lot of these things are going to be normal adjustment. Our kids are going to say something crazy and you're going to be like, what is happening? But, you know, not letting yourself go down that rabbit hole. You just, yeah. Unless you're looking for a provider.
Okay.
You know. And then, so the other thing too, interestingly, our kids go to the pediatrician 13 to 17 times in their first 3 years of life. So one of my other goals is, why wouldn't we also have a therapist just ready for you at the pediatrician's office? Can we normalize that? Because sometimes it is just nice to be established with someone before things are like up here, right? So if you had someone just access to, again, I'm happy to like provide recommendations just to have, I mean, next year, a school counselor, right? Like someone at school to just go to and chat with. Yeah, I mean, even so I'm at IMG today in the mornings, and the hospital does all their psychological services right now, but we just got them to hire a school counselor because there's so much need at like the prevention and like low level versus like the level that raises to like seeing me or seeing my sports psychologist there. So thinking about just before you need it, having it in your phone, having an awareness, knowing someone, you know, that's super important. I forgot I put these fun slides in here for you guys. I'll start here. This is one of my favorites. This was parents' mental health during the pandemic. 75% of parents said they could have used more mental support. 32% actually ended up out seeking treatment, and 24 were diagnosed with a mental health disorder. And then I think my favorite and most annoyed part of this is that dads ended up sleeping more than they wanted to during COVID. So I'm always like, yeah, I think that is true. On average, interestingly too, at the beginning of the pandemic, moms were drinking 10 additional drinks per week.
I believe it.
I mean, I think I lived it, right? Like, it was in that, so like the amount of coping we did with like unhealthy coping behaviors, super significant. I'll leave this up because it's also interesting to look at. It's average weight gain by category or average weight loss by category during the pandemic. So on average, women who gained weight during the pandemic gained 22 pounds. Men gained an average of 37 pounds if they gained weight during the pandemic. And then parents on average gained 36 pounds, and essential workers on average gained 38 pounds. So super interesting to look at, so I'll leave it up. But this is interesting data just to see like how much our lives changed, but also like how much we were utilizing unhealthy coping strategies that have long-term physical impact. Sleep, alcohol, weight gain, all have long-term physical health impacts, and the trauma of this you know, the data that I'm going to talk to you about 20 years from now is going to be fascinating as all of us start to reach like retirement and our elderly ages, like what our physical ailments look like at that point too.
Do you feel like now that kids, especially teenagers, are becoming more aware of these mental health issues? Because it seems like on all the shows that they watch, there's always something at the end that addresses that, and that was not always the case. And I kind of feel like I've seen other states that really put a lot of emphasis on overcoming the mental health stigma and trying to educate. And I don't know if Florida's doing that. I don't know.
Okay, so a couple pieces. Yes, so if there's anything the pandemic did that was super positive, it's brought mental health to the forefront, right? Like I think we've all really come to a place where we can talk openly about it and recognize mental health and physical health are one. House Bill 1451 passed, the Don't Say Gay bill. And the interesting pieces of that legislature include that, to your point about school counselors, in the public school setting, anything that's shared with the school counselor has to be shared with the parent. And so Florida presents some challenges for me ethically, for my providers, legally, and whether or not we can go into the schools and provide that, because what if something happens that, number one, a patient who's 15 years or older doesn't want to share with their family, or number two is something that could potentially lead to harm, right? So yes, we have a lot of work to do in terms of mental health in this state, but other states do a very nice job.
Do you feel like there are any organizations that you would recommend to like come into the school or?
It's tough. So NAMI, the National Alliance on Mental Illness, has some nice programming. Their programming is typically led by those who are like lived examples, basically. And so it really, then it depends on who you get. So NAMI has some nice programming. Actually, Claudine is working on some like wellness overall, and we talked about it for teachers, parents, and kids. So like the teachers also have to be modeling that and have to be well too. Again, I mean I can talk about these things all day, but the burnout of essential workers, and obviously we hear about the Great Resignation, but the mental and physical health impact of our first line providers throughout the whole pandemic has been significant. Not only, I mean, in my own team, but in every team. So yeah, there's so much opportunity and so much excitement, and I think we can do something really special here. We have a good opportunity.
It's interesting because I mean, Libby's in 6th grade, and it's the age, you know, where the hormones are going crazy and the girls are trying to figure everything out.
Yeah.
And that you're right, if you Google everything, you know, to try to say, well, am I anxious? Am I this? Am I that? You know, and it just seems like they really need something.
Yeah. And gender is like a whole other conversation, right? Like gender and gender identification is a whole other conversation that warrants like really looking at the research and data. Well, thanks guys. I'm here if you need it.